everybody. Welcome to the Echo Concussion YouTube series. Today, we're going to be talking about the important aspects of returning to activity, school, and work after a concussion. My name is Dr. Shannon Scratch. I'm a clinical neuropsychologist at Holland Bloorview Kids Rehabilitation Hospital. I'm also affiliated with the University of Toronto and am an Echo Hub member. Over to you, Leslie.
Hi, everyone. My name is Leslie Birkett. I'm an occupational therapist, and I'm also an assistant clinical professor adjunct at McMaster in the School of Occupational Therapy, and as well, I'm an Echo Hub member. So to begin, we wanted to remind you about the importance of early return to activity. You will have heard about this in previous Echo videos. So after a brief period of rest during the acute phase, for 24 to 48 hours after injury, patients can be encouraged to become gradually and progressively more active as tolerated. So it is important to know that the activity level should not bring on or worsen their symptoms. And you'll find this information in the Living Concussion Guidelines. Also available for you is this great handout for concussion do's and don'ts during the first days of recovery. So great points to go over with your patient. Next slide, please.
We're going to start off with return to learn and return to school. There was recently a concussion guideline update, and with that, they defined return to learn as returning to pre-injury learning activities with no new academic supports, including school accommodations or learning adjustments. So if a student did have an individualized education plan or extra learning resources before their concussion, we don't expect those to go away. But with the hope here, we're talking about full return to full-time school without any new accommodations related to the concussion. In the recent concussion guideline updates, there's an update to the return to learn strategy. This has multiple steps to help students get back to full-time school. As you can see, they have some outlined, some goals on the side that will show different trajectory that you can expect. We want people to go back to school pretty quickly after their concussion, within about 24 to 48 hours. We're no longer sitting at home until you're completely symptom-free. We do know that sometimes when you increase cognitive load, when you're at school a full day, you might have some wavering symptoms within about a 2-point scale. So if somebody has a little headache or is feeling more fatigued towards the end of the day, that's okay. We expect that as somebody starts to recover and return to school. The research shows that about 93% of athletes return to learning without accommodations within 10 days of a concussion. So most kids get better and most kids return pretty quickly within about 2 weeks. This is a great resource from our colleagues at Parachute, where they talk about some different strategies for helping students return to the classroom. They have different stages to show what people are ready for and different activities where people can engage in if they're tolerating things well during their recovery. These are also some important resources for return to school, and they, especially for high school students with School First, they talk about advocacy and supports that students should and can expect in school and advocate for. The Living Guidelines and Pediatric Concussion also have some really great resources, as well as the concussion statements. In the pediatric guidelines, there are different resources that clinicians can use that have accommodations for students in school and accommodation support letters as well.
All right, and now we're going to turn our attention to return to work. And it is important to think that we're not just talking about adults here. We need to remember our teens as well. Next slide, please. So the first question is when? Well, current evidence indicates that a graded resumption of regular pre-injury activities is tolerated, so in a manner that does not result in a significant or prolonged exacerbation of symptoms, within the first few days to weeks post-injury should be encouraged, because regardless of symptomatic status, activity is more likely to speed up rather than delay recovery. And this information is from the Living Concussion Guidelines. So what we're discussing here is that an early return to work is recommended in most situations. Next slide, please. All right, I wanted to share also this return to work algorithm. This will be really helpful for those who work in primary care. It has a variety of decision points and questions to help you guide your client regarding the return to work. And it's important to note Just as Shannon talked about with return to school, that the existence of symptoms at baseline is not in and of itself a basis for no return to work. This easy to use handout is available for you on the Living Concussion Guidelines. All right, and another great resource that I wanted to share with you is from British Columbia. And this shows a really nice step-by-step approach to the return to work process. It has some recommendations, some sample activities, and helps you identify when your client is ready to return to work. So we do know that while the vast majority of individuals recover from concussion relatively quickly, there is a small percentage who go on to experience persistent symptoms, also known as prolonged symptoms. And for those individuals, you will want to talk about fatigue management because we do know that fatigue is such a common symptom following concussion. So one great resource that is available for you on the guidelines are the Parkwood pacing graphs. This handout can be given to your patients to help them understand their fatigue and start to learn some strategies to try and manage or mitigate fatigue to help them get ready to resume their normal life activities. And when we think about return to work, it's really important to think about equity. So, what I mean here is that workers may require accommodations to successfully return to work. So, accommodations might be in the form of altered hours. Accommodations also might be in the form of accommodated duties. It's important to talk through this with your patient before returning them to work, and also to have a discussion regarding activities in the workplace that might be unsafe to do. Next slide, please. We wanted to share with you these resources that are available for you to loop back and take a look at in more detail. Next slide, please. And here's the QR code for Echo Concussion. So we wanted to share this with you, and we certainly hope to see you soon at UHN's Echo Concussion. And thanks for joining.
Thank you.